Hello and welcome. Today we have with us Dr. Ajitabh Srivastava, a liver transplant surgeon, and we are going to have some insightful conversation on liver health. Welcome, sir.
Thank you.
Sir, so my first question is, since you are a liver transplant surgeon, can you tell me when is it the utmost important for somebody to get a liver transplant?
See, liver transplant is a life-saving procedure for a person who needs one.
Okay.
Not all the patients with liver disease need a transplant, but once the liver disease has crossed a certain threshold, when the sustainability of life and the quality of life gets severely hampered, and that is the time liver transplant is suggested to an individual.
Right.
So, in a broad sense, liver transplant is a life-saving procedure. Without a liver transplant, a person's number of days is numbered.
Right.
Okay, so it is important that anybody who has a liver disease consults an expert in liver disease on a regular basis to understand what is the grade of liver damage.
Right.
And once the grade of liver damage is identified with corrective measures, the further damage can be halted, or once the damage has attained a threshold, transplant can be done. Liver transplant in today's time carries a very good outcomes. And yes, when it is done at a time when a person is in better health, the results are as good as 100% success.
Right.
So here comes the point when they need to consult their doctor so as to understand if the threshold has attained, not to delay any further,
Right.
and can get a transplant done.
Now, sir, in transplant, in the medical industry of transplant, I have this one specific question. Now we see a lot of pig organ being used for transplant. So, where does liver transplantation then stand in this?
Okay. So regarding xenotransplant, where you have got genetically modified animals,
Right.
right now it is mainly pig,
Pig.
because the pig genetic framework or chromosomal framework is quite similar to humans. So there is one chromosome 6 where there is slightly it is different, which is modified in the pig at an embryo level. So as a pig attains the adult size, that is a time when the organ also is genetically changed, is hormonally or chromosomally changed, and that is a time such organs can be used for people who are in need of organ. See, there is a vast scarcity of organs, and there is a lot of imbalance between the number of people needing a transplant and the number of transplant being performed.
Right.
And one of the bottleneck for this difference is the availability of the organ. So organs can be available either through live donor, normal person, or through diseased donor, cadaver, where a medium like this can be of great help in propagating organ donation,
Right.
which times is actively involved in. And the third, now it is still in the experimental stage for the liver transplant, but there have been a few successful xeno kidney transplant being done.
Right.
But yes, right now it is not being yet done in the liver.
Okay.
But I think so it's in this stage where I think so in a couple of years it would be done, and we'll see the results how it is.
Right. Now, sir, coming to the last leg of the conversation, prevention is always better than cure. So, if you have to give us one mantra to keep one's liver healthy, what can be done?
See, all the diseases these days are lifestyle related. India, because of its, I think so, obesity, unhealthy lifestyle, and diabetes being very prevalent, it is the incidence and the disease burden for liver disease is very high. And a lot of liver diseases, like which is lifestyle related,
Right, sir.
like say because of obesity, diabetes, and unhealthy lifestyle, can be prevented by change in your lifestyle,
Right.
which means eating healthy, exercising regularly. A lot of time people feel that walking, say 1 or 2 rounds, is exercise, but that's not exercise. You need to sweat out. It could be at least 30 minutes of your aggressive aerobic exercise where you
Right.
sweat out.
Right.
Your heart rate starts pumping.
Right.
Okay, that is what is required. Where you sweat, where you melt the fat from the liver. The third and the most important thing, which is generally not paid too much attention, is the sleep. Having a good night's sleep makes a lot of difference in overall your inner well-being.
Right.
One thing is noticed, once you don't sleep well, there are some endogenous hormones which get secreted, like ghrelin, and this generally makes a person eat more. The satiety center gets affected.
Okay.
So having a good night's sleep is one important aspect in prevention of liver disease.
Right.
And the fourth is, I think so, it's easier said than done, is coming down on your anxiety and stress. These days, all of us are living through so much of stressful life.
Right.
But yes, trying to curtail the stress by maybe meditating in a while meditation and our age-old yoga and breathing exercises can do wonders. So this preventive measures can prevent a liver disease from happening, or if a person has got a liver disease, these 4 pillars: diet, balanced nutritious diet, exercise, good sleep, and meditation. They are like 4 pillars of a chair.
Right.
Can prevent and can revert the fatty liver disease, which is very common in our
Right.
country these
Right,
days.
sir. All right, sir. Thank you so much, sir, for this insightful conversation.
Thank you.
Thank you.
Thank you for
Thank you, sir.
being there.